Second, you need to have so that the medication, and then after that you need all the supply to intubate. Third, you need the skills, and the skills is not as easy as well. And I mean, it's not very hard, but it is still an art, and there's some that are easier and harder than to do. But if you don't practice this, then you don't have it. So those are the three things just for the procedure itself. Fourth, the patient that requires that are very sick most of the time, because either they need that for maintaining their airway, so that means that they cannot hold their airway open on their own, or they need ventilation, so that means that we need to breathe for them, or they need oxygenation. So for example, if you have a bad pneumonia and you don't have enough oxygen that goes to your lungs, a good way to do that is through a ventilator, and you have. And so they're a very sick patient, they're a very critical care patient, and that means that they need a lot of care. So just the fact that you need to intubate someone already, it puts them in a different category. It's not the person that just cut themselves or something. It's somebody that will need care for 1, 2, 3, maybe even 3 weeks, 4 weeks. Sometimes they stay in the ICU for months. And so it's someone that needs a lot of care. A lot of care means that you need a lot of resource. And we're already in the scenario that you're resource limited because your system has collapsed. So it makes it kind of almost hard to think that you'll be able to, because as soon as that tube is in, so first of all those things, so you need to be able to know how to do it. You need to have the supplies to do it. There's a way to improvise it, but there's different techniques and stuff. But then once the tube is in, you have to leave it in, and now that person has to be sedated. There has to be, it has to have analgesia and stuff, and we're talking about keeping them for weeks and weeks. So already medication-wise, that's a lot. That's a lot of medication that you need to have for one person. And the also, if the person is intubated, that means you have to breathe for them. Just do a quick calculation. Let's say, because technically if we're in a collapse, that means you don't have, or you have very limited electricity and you have to choose what you have. And if you have a ventilator at home, don't know what you do with that things, but sure, let's say you do have one, but you do not have one, that means you need to bag that person for a long period of time. And just to do a quick calculation, let's say we would breathe you at 10 minutes. So that would mean every 6 seconds we would bag you. So 10 a minute, so that's just to make calculation easy, because usually you should breathe a little bit faster, but let's go with this. So 10, that's 6 a minute. So that means every six times in a minute, you have to do this. While multiply that by now 60, because let's say for an hour, how many times that is? And now multiply that hour by 2 hours and 3 hours. This is pretty much like, you would need like one person with like Popeye's arms to do like that kind of task, which is very unlikely that you'll be able to do that. To maintain the airway open is quite different. As if someone, for example, is just unconscious because she's unconscious for all different reasons, and we'll have a video on that, what the cause can be causing unconsciousness. To maintain the airway, but you know that this person can maybe come back, is quite different than having to intubate someone because you need to provide air. So right there, intubation for me is kind of almost out of the thing, because the patient that requires those skills, usually they require too much care, too much medication, and way too much things that in a limited resource, either it cannot be done, or they'll use pretty much like all the supplies that you have. And unfortunately, and so then it brings us to the one question too of that, In a situation like this, just like when we call mass casualty incidents where there's too many people over the resource, and as the definition usually mass casualty incident, which we call MCI, is that it's a situation where the incident overwhelmed the resource. So for example, if you have 2 paramedics and there's 4 victims, it's almost an MCI in a way. You don't need to have a plane crash, but it's just that it overwhelmed the resource that you have right now. Well, in a situation when you're limited resource, a patient like this could almost be a little MCI. And when you go in those things, you need to change your thinking, because you try to save as many as you can, basically. So if somebody, for example, if somebody coming in an regular day, come in cardiac arrest, we'll work on them for like an hour or 2 hours. Like we'll put like all the resources we have and stuff like that. In an MCI situation, we don't even touch them. They're called we put them black, and I'll put a little link on little tools that they use. They call it jump starts. It's to separate people, and we put them black. Is that we don't even touch them because they would require too much resource. That would put more people to death. So if you have the choice between having 3 people dead or 1 person dead, you choose the 1 person dead. And it's a hard decision to make, but it's a decision that has to be made at one point, because 3 is better than 1. And unfortunately, that's a decision that has to be made. And then I think in the scenarios, like a lot of times we see on the YouTube videos and on channels, those are the situations that would happen, is that the person would go, we would have to decide. Unfortunately, it's like, I know your life and stuff, but my resource, I cannot do that. And it has to be like that. Unfortunately, it's sad to say, but it would have to be something stuff. And to think that we can save everybody is not a proper way of getting prepared, because as we all know, survival is 90% brain, 10% skills. And I mean, to prepare yourself in a situation where your medical needs will be, is that you need to be prepared that you will have to take those decisions. Because if things do collapse, like people would say they would do and stuff like that, we're going back to maybe medicine from 1950, 1910. We're going way back. We cannot provide the care that we provide right now in a system that we would have, because we wouldn't have the resource that you have. Even if you have the knowledge, it doesn't matter. It's the resource that you would have. Like for example, if you take a neurosurgeon that can do surgery with like a robot and everything, and you put them in the middle of outside a hospital, in the middle of a field with someone with the same brain injury, what he wants to do, he doesn't have an OR, doesn't have things. Obviously, you'll be maybe able to use his skills to improvise something, but he's limited about what he can do. It's the same thing with the limited in a situation wherever the economic collapse or whatever you guys want to call it, whatever Pussy wants to call it. If it happens, you're limited. Even if you have the best knowledge of everything, you're limited by what you have. And that's why improvisation becomes very important, because you maybe be able to improvise some of the stuff that you can have. So it brings us